This research paper introduces a novel survival analysis model that predicts the time to total knee replacement (TKR) surgery in patients with knee osteoarthritis (KOA). The model utilizes features extracted from radiographs and magnetic resonance images (MRI), using both supervised and self-supervised deep learning approaches. These features are combined with clinical and image assessments, including quantitative and semi-quantitative measures, to predict the time until TKR surgery. The proposed model demonstrates high discrimination power by integrating deep learning features and clinical and image assessments from multiple modalities. It achieved an accuracy of 75.6% and a C-index of 84.8% for predicting the time to TKR surgery. This model has the potential to assist physicians in personalizing treatment strategies and improving patient outcomes. The paper highlights the importance of predicting time to TKR, as it can help identify patients at higher risk of rapid KOA progression and provide them with prognostic guidance before potential future health decline. The use of radiographs and MRI scans, along with quantitative and semi-quantitative assessments, is emphasized as the most commonly employed techniques for evaluating KOA. The research contributes to the field by leveraging deep learning techniques to extract relevant features from medical images and combining them with clinical assessments for survival analysis. The proposed model showcases the power of integrating multiple modalities in predicting the time to TKR, which could significantly impact the management and treatment of KOA patients. This study delves into the potential of deep learning (DL) models in predicting the time to total knee replacement (TKR) for patients with knee osteoarthritis (KOA). Utilizing data from the Osteoarthritis Initiative (OAI) database, which includes clinical variables, radiographs, MRI exams, and quantitative and semi-quantitative image assessments for 4,796 subjects over a 9-year follow-up period. The research cohort consists of 547 subjects who underwent TKR during this period. Both knees of the same patients are used as separate data points to enhance model robustness. The study introduces a multimodal approach that integrates clinical variables, quantitative and semi-quantitative assessments from radiographs and MRIs, and DL features into survival models to predict the time to TKR. This approach is hypothesized to result in more accurate estimations of time to TKR compared to models using only DL features. The study utilizes knee data from the OAI database, which contains longitudinal radiographs and MRI exams consisting of sagittal fat-suppressed intermediate-weighted turbo-spin-echo (ZE) and sagittal fat-suppressed three-dimensional dual-echo steady-state (DES) sequences. The use of right-censored data, representing event-free duration, is crucial in this study to avoid biased results. The proposed method aims to overcome the complexities of various factors influencing time to TKR by incorporating advanced tools for accurate prediction. By leveraging the power of DL models and incorporating multiple modalities of data, the study seeks to provide a more comprehensive understanding of the progression of KOA and its impact on the need for TKR. The research centers on estimating the time to total knee replacement surgery for patients with osteoarthritis, leveraging data from the Osteoarthritis Initiative (OAI) study. A total of 1,681 knees were identified, consisting of 895 knees that underwent TKR within 9 years and 786 knees as right-censored controls. These knees have complete clinical variables, radiographs, MRI quantitative and semi-quantitative image assessment measurements, and MRI semi-quantitative image assessment measurements using the MRI Osteoarthritis Knee Score (MOAKS) system. The study cohort identification is summarized in Figure 1, which illustrates the process of selecting the dataset from the OAI study. The dataset was partitioned into 1,239 training, 172 validation, and 270 test groups. Table 1 provides the baseline gender and age of subjects in the OAI study cohort, detailing the mean age and standard deviation for both males and females in the training, validation, and test groups. The data collected includes radiographic measurements, clinical data, and quantitative and semi-quantitative image assessment measurements. The study aims to leverage this comprehensive dataset to predict the time to TKR, aiding in early intervention and better management of osteoarthritis. The authors detailed the experimental setup and proposed model for predicting the time to total knee replacement, TKR, using radiographs and magnetic resonance imaging, MRI, data. The dataset comprises 270 test data, with subject-level splits for training, validation, and testing of both unsupervised and supervised models. Table 1 provides details of the study cohort and data splits. The input data includes clinical variables, X-ray quantitative and semi-quantitative measurements, X-ray alignment angle, MRI quantitative measurements, and MRI semi-quantitative measurements. The proposed approach is illustrated in Figure 2, which shows the flowchart of the model. The authors employ a self-supervised pre-training approach using the twin class distribution estimation (TWIST) framework to extract features from in-labeled 3D knee MR images. The TWIST framework uses a Siamese network to generate twin class distributions of two augmented MR images, with three loss terms: consistency, sharpness, and diversity. The consistency term enforces the class distributions of two augmented views to be consistent, the sharpness term enforces each sample distribution to be sharp, and the diversity term enforces different samples to be diversely distributed to different classes. Two separate 3D ResNet-18 models are trained on the ZE and DES MRI sequences using the TWIST framework. The ImageNet pre-trained ResNet-18 model is used to extract features from radiographs. The features extracted from both radiographs and MR images are then concatenated and fed into a feature selection module to select variables with over 90% availability across all subjects. The selected features are then used to train a survival model, specifically a random survival forest (RSF) model, to predict the time to TKR. In the realm of estimating time to total knee replacement surgery, this study leverages a novel approach through the use of two separate 3D ResNet-18 models for ZE and DES MRI sequences, as well as a 2D ResNet-18 model for radiographs. These models are trained using a supervised method, with labels representing time to TKR mapped to a normal distribution with a variance of 4 and a mean equal to the label. The Kullback-Leibler divergence loss function is employed during training, and the best model for each MRI sequence is selected based on the highest accuracy achieved on validation data. Once trained, these deep learning models are utilized to extract features from patients undergoing TKR. Feature selection and ensemble model training involve extracting deep learning features from the output of the last pooling layer, and incorporating available quantitative and semi-quantitative image assessment measurements. To handle missing measurements, the mean of non-missing values is used for quantitative data, while the mode of non-missing values is applied for categorical variables. A least absolute shrinkage and selection operator method is applied to the Cox regression model for feature selection, and a random survival forest model is used for time to TKR prediction. The random survival forest model's output consists of predicted survival probabilities, indicating the likelihood of not undergoing TKR surgery, for each subject over a 9-year period. A flowchart of the proposed model is presented in Fig. 2, and the Wilcoxon-Sindrank test is used to evaluate differences in performance between different models. The experiments and results are presented in Table 2, comparing the performances of various models using deep learning model features extracted from radiographs and the ZE and DES sequences, and incorporating them into clinical variables, radiograph and MRI quantitative and semi-quantitative image assessment measurements for time to TKR estimation. Notably, the random survival forest model utilizing self-supervised deep learning model features extracted from the DES and ZE MRI sequences exhibits comparable accuracy but achieves a superior C-index compared to the random survival forest model utilizing pre-trained MED-3D deep learning model features extracted from the DES and ZE sequences. This indicates that the proposed method may offer enhanced predictive capabilities in determining the time to TKR, potentially leading to more accurate treatment planning and patient management strategies. In a comparative study, the performance of various machine learning models in predicting the time to total knee replacement, TKR, for patients with osteoarthritis was evaluated. The investigation focused on both self-supervised learning, SSL, and supervised learning models, examining different combinations of clinical variables, radiographs, and MRI sequences. The results indicated that the random survival forest (RSF) model utilizing the Lasso-Cox feature selection method, achieved the highest estimation accuracy, 75.6%, and C-index, 84.8%, for predicting time to TKR. This model outperformed other models, including those relying solely on self-supervised deep learning model features extracted from radiographs and MRI sequences, as well as those combining clinical variables, radiographs, and MRI measurements. The study underscores the importance of incorporating diverse data sources and feature selection methods to enhance the predictive accuracy of machine learning models in healthcare applications. By leveraging a combination of clinical variables, radiographs, and MRI assessments, the RSF model demonstrated superior performance in predicting patient outcomes, suggesting potential benefits for clinical decision-making and patient management. The authors present the results of their proposed model for estimating time to total knee replacement surgery, comparing its performance to existing methods. Figure 3 displays the confusion matrices for plus or minus 1 year estimation using two models. A self-supervised model incorporating DES, ZE, X-ray, clinical, and measurement data from both TKR subjects and right-censored controls, and a supervised model using DES, ZE, X-ray, clinical, and measurement data only from TKR subjects. The Lasso-Cox feature selection method was applied before the RSF model. Table 3 compares the performance of existing methods using the subject cohort from this paper. The proposed model achieves an accuracy of 75.6% and a concordance index of 84.8%, outperforming existing methods. The number of features used in each study varies due to missing values and identical enrollment variables across all visits. An ablation study was conducted to analyze the performance of different models, including the Cox proportional hazards model, discrete time generalized linear model, GLM, and RSF model, using clinical variables, quantitative and semi-quantitative assessments from radiographs and MRI scans, and deep learning features extracted from these imaging modalities. The RSF model yielded the most favorable results, indicating its effectiveness in estimating time to total knee replacement surgery. Integrating clinical variables, quantitative and semi-quantitative assessments from radiographs and MRI scans, and deep learning features extracted from these imaging modalities into predictive models significantly improves the estimation of time to total knee replacement. The most comprehensive model, leveraging the entire study cohort of 113 variables, achieves a Sindex of 0.949, outperforming models that analyze deep learning features individually. Self-supervised pre-trained deep learning models outperform supervised models, which only utilize subjects who underwent total knee replacement within a 9-year time frame. Incorporating right-censored data enables the capture of the entire distribution of time to TKR, enhancing the model's generalizability by incorporating all available information. This approach differs from existing literature in its inclusion of deep learning features extracted from baseline radiographs and MRI into machine learning models, resulting in higher estimation accuracy and Sindex. However, the study's generalizability to more diverse subject populations remains to be further investigated, as the Osteoarthritis Initiative database used primarily consists of older, overweight, and Caucasian subjects. Future studies should consider additional factors affecting the decision to undergo total knee replacement, such as personal preferences and socioeconomic factors. Predicting the time to total knee replacement surgery remains a challenging task due to the complex interplay of factors influencing the surgery decision. Recent studies have demonstrated the potential of ensemble models for survival analysis in estimating this timeframe. These models integrate clinical variables, image assessment measurements, and features extracted from MRI sequences and radiographs using unsupervised deep learning techniques. The incorporation of deep learning-derived features has been shown to enhance the predictive performance of traditional survival models. This is attributed to the ability of deep learning algorithms to capture subtle patterns and relationships within imaging data that may not be apparent through manual assessment. By combining these features with clinical variables and image assessment measurements, ensemble models can provide a more comprehensive understanding of the factors contributing to the need for total knee replacement surgery. The use of ensemble models for survival analysis has been supported by various studies, which have reported improved predictive accuracy and robustness compared to traditional models. These findings suggest that the integration of deep learning-derived features and clinical variables can provide a more accurate estimate of time to total knee replacement surgery, ultimately informing clinical decision-making and improving patient outcomes. This research paper presents a comprehensive review of existing literature on predicting total knee replacement and diagnosing osteoarthritis using machine learning and deep learning models. The authors begin by citing relevant studies that have employed various approaches, including prediction models, machine learning algorithms, and deep learning models, to predict total knee replacement and diagnose osteoarthritis. The paper delves into the methodologies used in these studies, such as logistic regression, decision trees, random forests, support vector machines, and neural networks. It also discusses the use of deep learning models, including convolutional neural networks, CNNs, and recurrent neural networks, RNNs, which have shown promising results in image classification and time series data analysis, respectively. The authors highlight the importance of feature selection and data preprocessing in improving the accuracy of these models. They emphasize the need for robust evaluation metrics, such as sensitivity, specificity, and area under the receiver operating characteristic curve, AUCROC, to assess the performance of these models accurately. The paper also addresses the limitations of current studies, including the lack of standardization in data collection and preprocessing, the need for larger and more diverse datasets, and the requirement for further validation of these models in clinical settings. Finally, the authors discuss future directions for research in this field, including the integration of multimodal data sources, the development of personalized prediction models, and the exploration of new deep learning architectures that can better capture complex patterns in medical imaging data. In conclusion, this research paper provides a thorough overview of the current state of the art in predicting total knee replacement and diagnosing osteoarthritis using machine learning and deep learning models. It emphasizes the importance of rigorous methodology, robust evaluation metrics, and further validation in clinical settings to ensure the practical applicability of these models. The paper explores the use of deep learning models for two distinct applications in medical imaging: breast cancer grading and survival analysis, and brain age prediction. In the context of breast cancer, the authors employ a deep learning-based approach to grade tumors and predict patient survival outcomes using whole-slide histopathology images. This method leverages the potential of artificial intelligence in medical imaging to improve diagnostic accuracy and treatment planning. The study highlights the importance of this approach in enhancing our understanding of breast cancer biology and improving patient outcomes. The second part of the paper delves into the realm of brain age prediction, which is crucial for understanding neurological development, aging, and potential neurological disorders. The authors propose a novel method called gated knowledge distillation to regularize brain age prediction models. This technique aims to enhance the accuracy and reliability of these predictions by leveraging knowledge from multiple sources and incorporating domain-specific information. Both sections of the paper demonstrate the power of deep learning in addressing complex medical problems. By applying advanced machine learning techniques to large datasets of medical images, researchers can uncover new insights into disease mechanisms and develop more effective diagnostic tools. These advancements have significant implications for improving patient care and advancing our understanding of various diseases. The paper concludes by emphasizing the potential of deep learning in medical imaging, particularly in the context of breast cancer grading and brain age prediction. It underscores the need for further research in this area to fully exploit the capabilities of these technologies and translate them into clinical practice.